Dear students and my dear viewers, in the previous session we have discussed about kinetics of spine part 1. Okay, in that session we have discussed that there are 4 kinds of forces which are acting on the vertebral column. One is the compression, bending, shear and torque forces. These forces not only acting during normal functional activities, but also these forces are acting on the vertebral column at rest. Okay, in the previous session we have discussed the axial compression in detail. Now in this session we are going to discuss about bending, shear and torsional forces. Out of this, now we are going to discuss about bending. Okay, so in bending, bending is a kind of force which is acting on the vertebral column. So normally in the vertebral column movements we have discussed in kinematics that the flexion, okay, forward flexion. So here you can see this is the flexion. Here you can find this flexion, extension and lateral flexion, isn't it? So if you observe such kind of movements, what is happening here means, so the person is bending forward. Okay, this flexion, extension and lateral flexion are the anatomical terms, but in the normal usage, so what is the person is doing here? The person is doing forward bending. Here in the extension, the person is doing backward bending. In the case of lateral flexion, the person is doing side bending, we can call it as. So in the side bending, so we can find right side bending and also we can see the left side bending also. So these are the 4 types of bendings we can observe in the vertebral column. Okay, so what actually happens in the vertebral column during these movements? So this bending causes both compression as well as tension on the structures. So the bending causes what kind of forces? Both compression and tension on the structures of the spine. For example, in forward flexion, so if you consider this one, this is the schematic representation of the mobile segment. For example, if you consider this thing, this is anterior and this one is posterior. So the person is bending anteriorly, that means forward flexion is taking place. In which region the compression is taking place and tension is taking place? So in forward flexion, so the body, the superior body is moving or causing some forward movement over the inferior vertebral body. So what is happening here? So the anterior structures, that is anterior portion of the disc, so this one is the anterior portion of the disc, and the ligaments which are present on the anterior sides, and also the muscles which are present on the anterior aspects are subject to compression or subjected to compression. So in forward bending, the anterior region becomes the compressive region. Okay, if you see on the posterior aspect, the posterior subjects, that means the posterior structures which are subjected to tension, that means if you see the posterior annulus fibrosus, okay, what are the posterior structures you can find here, and the posterior longitudinal ligament, okay, and supraspinous ligaments and interspinous ligaments, okay. All these structures which are present, we can call it as posterior ligamentous complex, along with the muscles on the posterior aspect are subjected to tension, okay. So the posterior region becomes the tensile region, okay. So the resistance offered to the tensile forces by collagen fibers in the posterior outer annulus fibrosus, and also the zygapophyseal joint capsules and posterior ligaments help to limit extremes of motion and thus provide, so, and these structures provide stability. These structures provide stability in flexion. So if you want to see the structures clearly, you can find here. So these are the posterior structures you can find here. These are the supraspinous ligament, interspinous ligament, and this one is the zygapophyseal joint, and these are the zygapophyseal joint capsules, okay. So these are the structures which resist the forward flexion and helps in providing stability during flexion, okay. Now, so this is the forward flexion. So in this flexion, these things are going to happen, okay. So creep occurs when the vertebral column is subjected to sustained loading, such as it might occur in the fully flexed postures. Commonly we can see in the people working in gardening, okay, and fully extended postures. So some persons are painting a ceiling, so in those cases, okay, the vertebral column is subjected to sustained loading. The resulting deformation, that may be elongation or compression of all these supporting structures such as ligaments, joint capsules, intervertebral discs, leads to increase in range of motion beyond normal limits and place the vertebral structures at risk of injury, okay. And if after it extends, so these structures are elongated or compression, these are called as deformation. So beyond the elastic region, what will happen, it may go to some plastic region where you can at that stage we can have the risk of injury. So before that there is a chance of getting this creep come to normal within minutes or hours after cessation of the activities, okay. So now we'll consider in the extension what will happen. Now we will see in extension what will happen is, so again we will see here. So what is going to happen here? So in the extension means, so the vertebral body is the superior vertebral body is bending posteriorly over the inferior vertebrae. What will happen? This tensile structures become compressive region, and the anterior structures are going to stretch, and it becomes the tensile region during extension, okay. So normally the resistance to extension is normally provided by the anterior annulus fibers. So here, so anterior annulus fibers in this segment, in this mobile segment, we can see anterior annulus fibers, and also the zygapophyseal joint capsule, and passive tension in the anterior longitudinal ligament. And also there is a possibility of contact of this two spinous processes on the posterior aspect, also limiting the extension. Okay, so these are the things which are going to happen. Okay, if you observe, so these are flexion and extension. Now we will move on to the another type of bending, that is lateral bending. Okay, lateral bending, the ipsilateral, what will happen in the lateral bending, now we will see. Okay, now in the lateral bending, now in the same schematic representation, now we are going to consider this one is right side and this one is left side. Okay, side to side. So what will happen in the case of lateral bending? So if the person is bending on the right side, what will happen here? So the ipsilateral side, that means the same side, the right side of the disc is going to compress. Okay, that is in a right lateral bending. The right side of the disc is compressed and the outer fibers of the left side disc are stretched. So therefore the contralateral fibers of the outer annulus fibrosus and the contralateral intertransverse ligament help to provide stability during lateral bending by resisting extremes of motion. Okay, that means if in the right side bending, so the right side structures, that is the intervertebral disc, are going to compress, and this one, the right lateral bending, is resisted by the tensile forces which are created on the contralateral side, that is left side structures. What are those structures? One is the outer annulus fibers of the left side of the disc are stretched, and also the intertransverse ligaments on the left side. These two structures are going to resist the extreme motions on the right side. So these are all the things happening in the bending. Now we'll move on to the next force, that is torsion. So now we will see the torsion. So torsional forces are created during axial rotation that occurs as a part of the coupled motions that takes place in the spine. Okay, these torsional forces we can see in the coupled motions that takes place in the spine. Normally such kind of torsional stiffness in the vertebral column we'll see in flexion and lateral bending type of motions. In these two type of motions, the coupled motions are commonly occurred. Okay, the torsional stiffness in flexion and lateral bending of the upper thoracic region. Okay, upper thoracic region from T1 to T6 is similar, but torsional stiffness from T7 T8 to L3 to L4 increases. So from T7 T8 mobile segment to L3 L4, the torsional stiffness is going to increase, but at the level of T1 to T6 it is the same thing. Okay, the torsional stiffness is provided by the outer fibers of both the vertebral bodies. So both the vertebral bodies, outer layers of both the vertebral bodies take part in the torsional forces or torsional stiffness, we can see. And also the intervertebral disc. Next one comes to the intervertebral discs, and the next one is the orientation of the, so here you can see the orientation of the zygapophyseal joints, okay, or zygapophyseal joint facets. Okay, the outer shell of the cortical bone. So this one becomes the outer shell of the cortical bone, reinforces the trabecular bone and provides resistance to torsion. So these layers are going to give some resistance during torsion. Okay. When the disc is subjected to torsion, half of the annulus fibrosus fibers resist clockwise direction. Okay, so here if you can see, some of the torque is some of the fibers. For example, if the person is moving on the rotating, we can see, so rotating on the left side, for example, left side. So normally in the case of lateral bending, we can find some rotation in the vertebral bodies, isn't it? So these are coupled motions. Okay, so what will happen here? So half of the annulus fibers resist clockwise rotations, while fibers oriented in the opposite direction resist in the clockwise rotation. So for example, this half of the fibers are rotating in the anti-clockwise direction, and the remaining half of the fibers are rotating in the clockwise direction. So these two forces are acting on the in the different types of rotations. So one is clockwise direction and another half is acting counterclockwise rotations. So this suggests that the annulus fibrosus may be the most effective structure in the lumbar region for resisting torsion. However, the risk of rupture of disc fibers is increased when the torsion is combined with heavy axial compression, okay, and plus forward bending. Forward bending is added to the torsion, then there is a risk of rupturing of the annulus fibers may be taking place. Okay, this is about the torsion. Now we'll move on to the shear forces. Yes, shear forces act on the midplane of the disc and tend to cause each vertebrae to undergo translation. For example, anterior to posterior. So this one is anterior to posterior side. Okay, and also from side to side in relation to the inferior vertebrae. In the lumbar spine, the zygapophyseal joints resist some of the shear force, and so here, okay, some of the shear force, and the disc resists the remaining. Okay, and the disc resists the remaining shear forces. So when the load is sustained, okay, when the load is sustained, the disc exhibits creep, and the zygapophyseal joints may have to resist all of the shear forces. Okay, when there is a sustained load acting on the discs, so what the entire shear forces are resisted by this zygapophyseal joints. So these are the things you have to consider in the shear forces. So these are all about the kinetics of the spine. Okay, so the same kind of forces, okay, and also the kinematics and the kinetics. So what we have already discussed in the previous sessions, so we are going to relate the same kind of kinematics and the kinetics in different regions, like in the cervical region, or what is the kinematics and kinetics we can observe in the cervical spine, in the thoracic spine and the lumbar spine. Okay, like that we are going to discuss region wise in the coming sessions. Thank you.